Did your orthodontist or dentist or somebody else important just tell you that you need 2 phases of braces or orthodontic treatment? Here is what you need to know about 2 phases. Time for some PFOing so you know where you're going. Welcome back, everybody. I'm Dr. Ryan Packard at Packard Family Orthodontics. I'm wearing something a little different today. Still got the backwards hat going on. A little bit of this. Today's episode is about 2 phases of orthodontic treatment. Maybe your dentist was like, hey, you know what? You better go get a consult. You might need 2 phases of orthodontic treatment, or you might need an early phase or a phase 1. Those are different names for early treatment. There's just lots of things. You might be seeing a lot of young kids with braces or expanders, and then you're like, well, then there's these old kids, or when I was a kid, I only had braces when I was older. So what is this all about? We're gonna dive into a few of the details about 2 phases of orthodontic treatment. But before we get there, remember, if you like this video, give us a thumbs up. If you have any questions about different phases of orthodontic treatment, or what the first phase is, or the second phase, or any other questions, or just comments, feel free to put it down. And consider subscribing to our channel so that I can open your eyes to the wonderful world of straight teeth and beautiful bites. What is 2 phases? There are lots of different things that are considered orthodontic problems. For example, crowding, crooked teeth, overbites, in the orthodontic world called overjet, deep bites, crossbites, impacted teeth, spacing, the list goes on. There may be benefits to treating certain of those problems at different times. Because of the possible benefits of treating those things at different times, your orthodontist may say, hey, you know what? I think you might benefit from a phase 1 or an initial phase of orthodontic treatment. Usually, this initial phase or phase 1 is considered when the child has some baby teeth and some permanent teeth. That can be somewhere between 8 and 10 years old, but it varies for each individual. Phase 1 can also be referred to as early treatment or interceptive treatment because you're trying to intercept problems as they develop. Like I said, it could be considered early treatment because it's earlier than your later treatment. You're a teenager, and because you are at that age, between 8 and 10, usually you are in the early mixed dentition, a mix of permanent and adult teeth. Okay, anyways, those are the different names of early phase 1 treatment. Some of the issues that you might try to address in an early phase of treatment, or the first phase, is like a crossbite in the back, posterior crossbite, when your teeth don't fit together the right way, and maybe you're like, kids don't like this, or like this, walk around like that. Those are things that maybe an expander could help with, or sometimes you have 1 or 2 teeth that are tipped backwards or too far forwards, and so you can use braces or Invisalign, like a clear aligner system, or maybe even a retainer to try and push the tooth into better position. Or sometimes you're like super duper crowded and you maybe need to consider putting something in to make more space. Maybe you've lost a baby tooth early, or maybe you need to consider getting a baby tooth extracted and then you need to hold the space while other permanent teeth grow in. Those are all things that maybe you would consider early orthodontic treatment for. Again, not everything. Definitely go see your orthodontist if you want to know what's good for you. Okay, then you spend just a little bit of time in the early phase. The intention of the early phase, or the phase 1, is to try and address specific discrepancies or issues in development. Not everything, just some of the things. And it's supposed to be relatively short in time. Then you finish, you might be in retainers, and you wait for a period until the rest of the permanent teeth grow in. And then hopefully around that time, we're getting closer to our adolescent growth spurt, and we're like, okay, it's time to be reevaluated for comprehensive treatment, or phase 2, where you try to tackle all the problems related to alignment, straightening of your teeth, and beautifying the rest of your bite. And that's where you do like braces or clear aligners or whatever your system tool is. You can even do expanders then. But you do all of that in the later years, or like early teens. That's when we're considering phase 2, the comprehensive round of braces. Phase 2, comprehensive round. So that is what 2 phases of orthodontic treatment is. Maybe some benefits treated when we're young, then we take a break, maybe a year, maybe 2, could be even less than that. Sometimes you, depending on when you start, you might actually just transition straight into phase 2 and you make it one whole long treatment. But generally, phase 1, break, phase 2. Early, address specific issues, take a break. Phase 2, reevaluate all the issues and see what needs to be tackled still. Okay, so who needs 2 phases? Does everybody need it? No, not everybody needs 2 phases. So when you're visiting with your local orthodontist or your dentist, whoever your provider is, they say, hey, we should consider doing this. You can say, okay, well, what are the benefits of doing early treatment? What are the risks of not doing early treatment? And then you decide together with your provider, hey, does this benefit outweigh the risk of only doing one later phase of treatment? And you can decide together, because it's important to note, does completing early phase 1 treatment, does that mean that you won't have to do phase 2? Is that the goal? Is that you do early treatment so that you don't have to do phase 2? Research has come out to suggest in plenty of situations, early treatment does not prevent you from having to, or guarantee that you don't have to, do a later comprehensive phase. So I wouldn't get into phase 1 just because you're like, hey, if I do this, then I don't have to do that, okay? I wouldn't think that way. Phase 1 can make things a little easier later. It can, but it depends. There is research out there that suggests that just because you do phase 1 doesn't mean that phase 2 is going to be easier or that it's going to take less time. Despite that, right, there still may be benefits to doing phase 1 treatment. That's why you need to talk to your local orthodontist. Okay, so not everybody needs 2 phases. Talk to your provider to see if 2 phases would be beneficial to you. Okay, so we talked about what the 2 different phases of orthodontic treatment are. That's generally, okay, when we talk about phases, usually it's only 2. There's early, then there's usually a break, and then there's a comprehensive phase. So specific targeted issues, then a break, and then we address all the comprehensive issues. And not everybody needs to go through 2 phases. Plenty of people benefit from having 2 phases. And then there are also many people, plenty of people that can get the similar results, if not the same, by just doing 1 phase. What about the 3rd, 4th, 5th, and 6th phased patient? It's common if you don't wear your retainers. Don't let anybody tell you that you can stop wearing your retainers, because if you do, you will find that you are going beyond the traditional 1 to 2 phase treatment plan. Okay, it doesn't matter how long you're in the braces, teeth can move without retainers. So best strategy is long-term plans for retention or retainer to try and prevent phases, multiple phases into adulthood and beyond. Wear your retainers. Okay, hope you liked the video. If you did, give it a thumbs up. If you have any questions about 2-phase treatment or the different types of things related to 2 phases of treatment, leave a comment or a question. Hopefully you got enough information. Visit with your local provider. And of course, consider subscribing to this channel so that I can open your eyes to the wonders of straight teeth and beautiful bites. That's all I've got, just a little PFO, so you know where you're going. Packard out.